Mothers and fathers feel happy with baby's movements, but both would be worried if movements are reduced on certain days. So question is, if this happens, is it normal or abnormal? Hello everyone, I'm Dr. Kriti Agarwal, consultant obstetrician and gynecologist from Kolkata, and in this video we will discuss what's normal baby movements and most importantly what's abnormal and when to contact your doctor. So first let's talk about normal fetal movements. Most mothers feel baby's movement for the first time between 18 to 20 weeks if you're a first time mom, and as early as 16 weeks it can be felt by second time moms. As pregnancy advances, these movements become more prominent. By 32 weeks, a regular pattern of baby's movements is established and all parents are aware of this pattern. For example, some babies are more active during the day, whereas others are more active during the night. And it's important to be aware about this pattern rather than counting movements. There are certain situations when the perception of fetal movements can be altered, such as if your placenta is in the front wall of the uterus, or if the baby's head has moved down, such as during engagement, or if the amniotic fluid is less. But you will still be able to feel a regular pattern of movements, and understanding this pattern is of utmost importance. If you feel a sudden change in the pattern of movement, such as absent movements or decreased movements, then it is best that if you lie down for 2 hours and count your baby's movements. If you are working, you can rest. If you are hungry, you can eat something, you can hydrate yourself so as to increase the baby's movements. Ideally, if you are lying down on the left side for 2 hours, you should be able to feel about 10 movements in 2 hours. And if this doesn't happen, you should contact your doctor immediately. You should never go to bed at night with the reduced fetal movements without taking your doctor's opinion. In such situations, your doctor will advise a test called Nonstress test to understand baby's well-being. In this test, a belt is tied around the mother's belly after localizing the fetal heartbeat. This test is done over 30 minutes, during which the mother would be asked to press a button if she feels the baby to move. At the end of the test, a graph similar to the adult ECG would be obtained and the baby's heartbeat pattern would be observed in response to the fetal movements perceived by the mother. If the result of this test is normal, and if by the end of 30 minutes the mother is able to feel the baby's movements, she can go home. However, if the test result is abnormal, or if the mother is unable to feel the baby's movements by the end of 1 hour of this test, then an ultrasound color Doppler would be advised for the mother so as to understand the baby's growth, the fluid around the baby, which we call as amniotic fluid, and Doppler studies would determine the blood flow to the baby to understand that the blood flow is getting compromised or not, which could contribute to less fetal movements. If you have any questions regarding baby's movement, let me know in the comments below.